Hi there, welcome back. It's so nice to see you.
Nice to see you too.
It's been almost a year since we last saw each other, and I just wanted to ask, how are you doing overall?
Yes, it's pretty good. I'm busy for the work, except that, and also I'm doing others and relax myself.
Good. And so in terms of your stress levels, how would you say you're doing from 1 to 10, 10 being the worst amount of stress?
Yeah, I think it's about 5.
Okay, not bad. So what are your main sources of stress?
Yeah, it's except the work, and most time I'm just every day morning I'm doing the exercise. And also is sometimes play the guitar, sing the song, and sometimes I drink a little bit.
So this is to help you like kind of reduce your stress levels.
Yes.
These are the things that you do.
Yeah.
Sounds wonderful. Now make sure you don't drink too much alcohol, but I think you're playing music. You said you play the guitar, you said?
Yes, I do sing a song, and my national songs, other song,
That's wonderful. I think that's a really great way to really connect with yourself and to connect with others and keep yourself happy during such a difficult time. So I'm really proud of you for doing that. Let's go ahead and start your physical exams. Is there any changes to your health that you'd like me to know about?
Yeah, it doesn't have, so it's almost normal,
Okay, so not many changes? All right. Okay, please place this under your tongue and then close your mouth. Let me take a look. Okay, 36.41, no fever. That's great. I'd like you to raise your hand all the way up to the top and 10, pump it 10 times. Good. So on your left side, it's 140/80. I'm going to check your right side as well.
Okay.
Have you been checking your own blood pressure regularly?
Yeah.
And how has it been?
Yeah, about around 50, 80, like that.
Okay.
Sometimes 140.
Okay, I see. Same thing, raise your hand all the way up. 10 times, please. Relax your hand. So on your right side, it is currently 148 over 80. So it is quite high. Are you taking your blood pressure medication?
Yeah.
Okay, so continue taking that, and I might actually change the dose a little bit.
Okay.
Make sure that you're continuing to exercise, that you're continuing to reduce your stress levels.
Okay.
Drink plenty of water. Okay? All right. And also to have a good healthy diet, eat lots of fruits and vegetables. This can potentially help as well. All right. Just take your pulse, you just relax. Just make a few notes. Now I'm going to go ahead and inspect your scalp and your skin.
Okay. Have you had any issues with your hair or your head? Any problems with your head or your hair? No.
Okay. Sorry, I kind of messed it up. Let's make it look good again. take a look back here, right? Just inspecting to see if there's any nevi that are potentially concerning. Okay. Okay, let's see here. And you're turning 60 this year, yes?
Yes.
How do you feel about that?
Yes. Still, I think I'm young.
That's great.
Yeah.
All right, you still have a nice full head of hair.
Mm.
There's a little bit of thinning at the top, but overall, still quite good.
Yeah.
I haven't seen any issues with your scalp, any redness or any patches, any nevi that are concerning. So yeah, everything looks good here. It's great. I'm just going to take a look at your face, okay? Okay. I'm just going to press down. Let me know if you feel any pain here. Any pain?
No.
Okay, good. Any pain here?
No.
Okay, those are your sinuses. There's no issues there. Eyebrows look good. Okay. Let me know if you feel any pain or tenderness,
No.
okay? Okay, I want you to open your eyes. Take a look here at your conjunctiva. Okay, no jaundice, no paleness, and also no signs of conjunctivitis, no discharge in the eyes. Really good. Okay. Okay, let's take a look at your neck area. All right, I'm going to go ahead and palpate your lymph nodes. So I'm going to start with the occipital back here, then the tonsillar, mandibular, submental, anterior cervical, posterior cervical. I'm going to go in a little bit deeper. Okay, just relax right there. Good. I want you to shrug your shoulders like this. Supraclavicular. Okay, relax. Infraclavicular. Good. Okay. No issues there. Let me take a look at your thyroid, okay? Can you swallow, please?
Open more.
Like swallow. Okay. Just noticing actually a tiny little lymph node there, but it's not enlarged. Is there any pain here?
No.
Okay. It's interesting that was right on top of the thyroid tissue, but it does seem to be separate from it. There are no issues with the thyroid. That's good. Just going to check the trachea as well. Make sure there's no deviation. Great. All right. So let's continue with an eye exam. Just look straight ahead, please. Okay. I don't see any problems with your lens, iris, or your sclera. Let's look on the other side. No issues here either. Now I'm going to be checking for your pupillary constriction. Good. Okay. Look straight ahead, please. Good. All right. Now I'd like you to just look at the pen, the tip of the pen here. Okay, just keep looking at it, and then look back at that wall, back at the pen. Keep looking at the pen. Great. No issues with accommodation or convergence. Now I'm going to do the H test. I just want you to follow again the top part of the pen here. I'm just going to move it. I don't want you to move your head. Just move your eyes, okay? Okay, so try not to move your head, okay? Just your eyes. Good. We're just testing cranial nerves 3, 4, and 6. Great. All right, so now I'd like to check your peripheral visual fields. I want you to close this eye right here and then look directly into my eye. And so don't look at my hands, just look into my eye. Tell me when you start to see the tips of my fingers. Once you see this, this part, let me know, okay? So don't look at my fingers. 1 second. Let me know when you see it, okay?
I see.
Don't move your eyes, just look at my eye. One more time.
I can see now.
Good.
I can see now.
Good.
I can see.
Good. No, same eye.
I can see.
Good.
I can see now.
Okay.
I can see now.
Okay, switch eyes.
I can see.
Good.
I can see. I can see now.
Okay.
I can see.
Okay.
I can see.
Good. So just look in my eye.
I can see.
Great. Okay. Just going to make some notes again. No defects of the peripheral fields. No defects of cranial nerves 2, 3, 4, and 6. Okay. Next, we're going to do some ophthalmoscopy. Just give you a moment to rest. I'll go on your other eye. Okay, so again, look straight ahead at the wall. Just checking for your red light reflex right now. Adjusting the... There you go. Alright, I can see the optic disc with a clear outline following the blood vessels. Okay. Move on to the other eye just for a moment. Okay, so on this side, your optic disc looks great, clear outline. I don't suspect papilledema. The cup to disc ratio is good as well, so I don't suspect any glaucoma. Your arteries and veins, there's no nicking, there's no hemorrhaging, there's no spots. The retina color is normal as well. I'm just going to take a look at this eye one more time, okay? Just keep looking straight ahead. Good. Alright, so your retina and your optic disc and cup also look perfectly fine on this eye, so nothing to worry about. So I'm going to go ahead and palpate your ears. I know you've had issues with your ears before. Can you remind me which ear it was that you used to have infections?
Yes, before I have infections.
Which ear was it? The right or left?
I think that's left one.
Side?
Before, yeah.
Okay. Any issues here?
No.
What about
No
here?
problem.
Okay. And this side? Any pain?
No.
What about this?
No.
No? Okay. Have you had any trouble with your hearing?
No, it's normal.
Normal?
Yeah.
Okay, good. Getting sleepy? Let's take a look inside. Okay. Cone of light, anterior and inferior, present. Malleus is present. Pars flaccida intensa, no issues there. The center of the tympanum, there is a little bit of like red vascularity. Clear ears, no cerumen present. That looks quite healthy overall. Let's look at this ear now, the one that you've had trouble with before. Okay. The cone of light is quite reduced, actually. It's still anterior inferior, but not as present as in the other ear. It does seem to be a little bit cloudy on the other side, not as translucent. There's quite a bit more erythema on the tympanic membrane, especially on the anterior superior area, kind of where the malleus handle is. The bony landmarks are not as visible. Most of the erythema is on the pars flaccida. And there's a bit of erythema in the canal as well. And I do see, it looks like there are a few hairs kind of internally close to the tympanic membrane. There also seems to be a furuncle in the canal, but no signs of cerumen. Is there any pain in this ear when I went in?
No.
Okay. I would definitely still be careful of this ear. Are you using any cotton swabs?
Yeah, sometimes.
Please try not to. This ear seems quite susceptible. There's still some cloudy discharge on the other side. There's still some kind of redness. So I would just be really careful with this ear. Okay? And let me know if you feel that you have any infections. I can definitely help you with that. Just gonna take a look inside your nose, okay? In your nose, yeah. Okay, mucosa is pink. No issues with the septum. No signs of discharge. Good. Looks good. Please open up your mouth. Say ah. Okay, so try to flatten your tongue on the bottom and say good. Say ah. Okay, one more time. Ah. Good. One more time. Ah. Great. Okay. All right, so no enlargements of your tonsils. The pharynx in the back looks good. No signs of infection. Your uvula is symmetrical midline. And yeah, so no issues there. Let me take a look at your teeth and your gums, okay? Okay. I've been seeing a dentist regularly.
Yeah.
How many times a year?
2 or 3 times.
Okay, good. When you look at the top, right? Other side. I want you to raise your tongue up like that. Down. To the side. Good. Other side. Great. Okay. Looks good. Uvula, tonsils not enlarged, mucosa pink, no redness, no lesions, cancer check, negative. Okay, good. Can you please lie down, face up that way? Yeah. Okay. Is it okay if I unbutton the top of your shirt? Okay, so we're just going to unbutton the top here. Okay. So I want to start off just to listen to your lungs. Every time my stethoscope touches your skin, I want you to take a deep breath in and out, okay?
Okay.
A deep breath in and out. Deep breath in and out. Deep breath in and out. Good. I'm just going to lift up your shirt. Is that okay? Good. Deep breath in and out. Deep breath in and out. Breath in and out. Breath in and out. Go ahead. And down. All right, great. So your lungs sound great, all clear. They're mostly vesicular sounds except for bronchovesicular sounds at the top, which is completely normal and healthy. I didn't hear any extra sounds such as wheezing, rhonchi, or crackles, which is a really good sign. Let's go ahead and listen to your heart, okay? I'll start at the bottom here. And just breathe normally. that sounds great. S1, S2 sounds are present. The S2, there's a little bit of physiological splitting upon inspiration, but other than that, no other extra sounds. I didn't hear any clicks or any murmurs, so it's great. Now I'm going to go ahead and move on to your abdomen. All right. So you can just go ahead and button up the top. All right. Go ahead and start. I'll start by auscultating your abdomen. Have you had any issues with your abdomen? Any stomach problems? Any intestine problems? Okay, good. Okay, bowel sounds are within normal range. They're not increased or reduced, so I don't suspect any issues there. I'm going to go ahead and percuss around your abdomen. Just take these off actually so I can hear it better. How many times are you going to the bathroom to have a bowel movement?
1 day, 1 times or 2 times.
Okay. And how do they look? Are they soft, hard?
Sometimes hot, sometimes soft.
Okay. Do you ever have like diarrhea?
These few times. Not so much.
Very rare. Okay. What color? Is it brown, yellow? Is there any red inside?
Like close to the yellow at the brown.
Okay, so kind of in between?
Yeah.
Okay. If you ever see any blood or any like mucus in the stool, please let me know, okay?
Okay.
Did you have a bowel movement today? Did you go to the bathroom today?
Yes.
You did? Okay. Just hearing a little bit of dullness here. But the rest of your belly is tympanic. So I'm not worried about any masses. It's really just this part that's close to it's in the descending colon and area, which I imagine is just stool. Okay, good. Now I'm going to do a palpation, okay? Let me know if you feel any pain or tenderness. I'm going to start with just a superficial palpation. Okay, can you raise your knees, please? You seem to be guarding a little bit. Good. Any pain? Any pain down here?
Yeah.
Good. I'm going to go a bit deeper. Okay. Any pain here? What about up here?
No problem.
Okay. Okay, good. Just gonna check abdominal aorta. Okay. I'm going to go ahead and palpate your liver, okay? Take a deep breath in and out. Deep breath in and out. Good. Now your spleen. Deep breath in and out. Deep breath in and out. Okay. Deep breath in and out. Good. All right, so both your spleen and liver are non-palpable at the moment. I'm just going to check your kidneys as well. Deep breath in and out. Okay. Deep breath in and out. Okay. Kidney is also non-palpable. All right. Let's go ahead and cover you up. Okay. So now I'm just going to check a few pulses, all right? Can I take off your socks? dorsal pedis pulse, brisk 2 plus, posterior tibial, brisk 2 plus on that side. Brisk 2 plus on that side, good. Just going to check for any signs of pitting edema. Great, no signs of pitting edema. And also just check your feet here. And your nails, capillary refill, less than a second. Great peripheral circulation. Just going to do a few myotome tests while I'm here. I want you to push against my hand, okay? Can you push against my hand? 2, 3, 4, 5. Good. Can you push down against my hand? 1, 2, 3, 4, 5. Other side. Push up against my hand. 2, 3, 4, 5. Push down against my hand. 1, 2, 3, 4, 5. Great. Now, push up against my hand. 1, 2, 3, 4, 5. Good. Push down against my hand. 1, 2, 3, 4, 5. Up against my hand. 1, 2, 4, 5. Down against my hand. 2, 3, 4, 5. Great. Slightly diminished patellar reflex. Okay, I want you to push up against my hand here. Push up. 1, 2, 3, 4, 5. Great strength up here. 1, 2, 3, 4, 5. Wonderful. Oops. Can go ahead and sit up. Okay, I'll continue doing your reflexes and myotomes.
Okay.
Just actually want to bring this up. Good. Try to relax as much as you can, all right? Try to relax as much as you can. do a few more myotomes. Push into my hand, push forward into my hand. 2, 3, 4, 5. Push back into my hand. 1, 2, 3, 4, 5. Push side into my hand. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Push up into my hands. 1, 2, 3, 4, 5. So I want you to push up into my hand. 1, 2, 3, 4, 5. Down into my hand. 1, 2, 3, 4, 5. I want you to push up into my thumb. 1, 2, 3, 4, 5. Squeeze my fingers. Squeeze, squeeze, squeeze. Good. Now try to resist this pressure. So spread your fingers. Good. Oh, one more I forgot. Push into my hand here. Just with the arm. Just with the arm. This arm. There you go. 1, 2, 3, 4, 5. This side. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Wow. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3, 4, 5. Excellent. All right. Next, I want you to use your index finger, touch my finger, and then touch your nose, okay? Touch your nose, back to my finger, touch your nose, back to my finger, touch your nose, back to my finger. We're going to go faster, okay? Testing your coordination here. Very good. Okay. Now I'm going to try the other hand as well. Great. All right. So back of your heel, slide down your shin. Wonderful. Okay, now I want you to do this movement and try to do it this way.
Yeah.
Try to go faster. Wonderful. All right, you're doing great. This is the last part of our exam. Can you please turn around and face that way? Great. I'm just going to assess your lung function a little bit more, right? Now, is it okay if I lift up your shirt from the back?
Okay.
Just gonna lift up your shirt like this. Okay. Can you give yourself a big hug? Can you hug yourself? Okay, good. Yes. So now I'm going to do tactile fremetis. So every time my hands touch your skin, I want you to say 99, okay? All right, go ahead.
99. 99. 99. 99. 99.
Great. So I could feel the vibration but not too much, and it's also not reduced, so that's really good. I'm going to go ahead and do some auscultation. Every time my stethoscope touches your skin, I want you to take a deep breath in and out, okay? Breathe in, out. All right, again, just like the anterior lungs, I was able to hear mostly vesicular sounds, except some bronchovesicular up here, and again, no adventitious sounds. All right, so great lungs. And I also want to test your chest expansion. Just going to do some locating here. Take a deep breath in, please, and out. Great. All right. Go ahead and turn around. All right, so we have completed all the physical exams necessary for today, and it looks like you're in really good health. The only concern is the blood pressure, and I will make a note of all of the things I want you to do, but primarily continue doing your exercise, eat plenty of fruits and vegetables. I want to see you eat probably like half of your plate with vegetables, and drink lots of water, and the most important thing is to try your best to reduce your stress levels. So that means taking a lot of time to do the things that you love, and taking time to just rest, take deep breaths, spend time in nature. Those things will really help, especially during such a difficult time right now. Okay, and make sure to surround yourself with people who will listen to you, who will support you, like your wife and your children. Talk to them, and yeah, just make sure that you are getting the support that you need, because you do have a difficult life, and I can really appreciate the stress that you're having. Other than that, I don't see any issues. The one thing is pay attention to this ear here. There is still some signs that it's recovering from infection. But other than that, do you have any questions for me?
Thanks.
No? Okay, great. So again, really proud of the progress you're doing. Keep it up, and I will see you next year.
Thank you.
Okay, take care.